this video, we'll assess glenohumeral joint play. First, the patient is in a seated position to begin palpations. The glenohumeral joint consists of the long bone of the upper arm, the humerus, which forms the ball at the proximal end, and the scapula that comes across to form the socket that the ball sits in. The ball is bigger than the socket, which allows for great range of motion such as flexion and extension and abduction and adduction, as well as internal rotation and external rotation. The patient will now lie supine to begin the special tests. Once the patient is supine, the arm will hang off the table. The patient's arm will be in a resting position and the glenohumeral joint will be abducted to approximately 55 degrees and flexed to approximately 30 degrees. For an inferior glide test, one hand will support the arm to maintain a resting position. The opposite hand cups the superior aspect of the humerus and slight traction is pulled to test for inferior instability. For an anterior glide, one hand stabilizes the scapula anteriorly by applying pressure over the coracoid process. The opposite hand applies a force from the posterior side of the shoulder. We will then pull up to test for anterior instability of the shoulder. To test for a posterior glide, one hand will stabilize the scapula, the coracoid process, and the scapular body. The opposite hand will then apply force anteriorly to the humeral head and press downwards to test for posterior glide and posterior instability. Signs of a positive test would include pain or instability at any direction of an inferior, anterior, or posterior glide. This would indicate instability of the shoulder.